And as cases continue to rise around the state and the country, hospitals have been inundated, some now running out of beds. But how are things looking here locally? Well, Uick spoke with some of Ohio's major hospitals right here in Northeast Ohio, and he has this report.
We're definitely in a fifth wave right now. I would say the cases are about as high as they were in March 2021.
Hospitals across the country are being pushed once again. With rising COVID cases due to the Delta variant, some ICUs in places like Montana, Alabama, Georgia, Florida, and Texas have reached or are nearing capacity. Here locally,
we're here for folks who need help, so there's no question there. But there are a lot of cases of COVID in the community right now.
We're certainly seeing a high volume of COVID patients like every other hospital. That being said, we're fortunate to be part of a very large system, and so our teams have been working very hard to assure that we are able to care for all the patients who need our care, both COVID and non-COVID in the system.
MetroHealth, Cleveland Clinic, and Akron Children's Hospital all say they're not to the point of worrying about capacity or turning folks away, but they all are seeing a rise in cases. In fact, Akron Children's Hospital says with 18 children yesterday, it marked their highest single day for children hospitalized with COVID-19 since the pandemic began. As cases rise, hospitals are also dealing with another issue.
I think what makes this time harder is there's a labor shortage right now, in all sectors of the economy. The combination of COVID with, less people that are able to work right now, which are making things difficult.
Even with less workers and more COVID hospitalizations, both Dr. Margolius from MetroHealth and Dr. Strosaker with say they don't see it affecting other surgeries and procedures anytime soon.
When we postponed elective procedures as part of the state mandate back in the spring of 2020, we saw that there were real health consequences. We're very committed to doing all that we need to do to be able to assure that we can care for both COVID and non-COVID patients.
To put this in context of where we are, just a few months ago here in Ohio, July 17th, the amount of COVID patients in our hospitals were just 1 in every 60 patients. Well, now we fast forward to today, and that's now 1 in every 6. So quite a drastic change, and it sounds like a record broken months ago, but all the hospitals say the best way to keep them open and seeing people is simple. Get your vaccine and wear a mask. Russ?
Alarming statistic. Will Uick, thank you.